and she has a history of bedwetting, and she is generally sleeps through the night, occasionally bets the bed, appetite is good, and her first word was at the age of 11 months, and she began walking without assistance instead of at 12 months, at 14 months. What do you want to do? Basically, there is a critical age. Only after that you need to consider how to manage the bedwetting. So reassurance is what you have to do in this given case. A 45-year-old man is being brought to the physician. He's crying and saying that I can't believe it. Recently he got a promotion. And when asked what will he do, he states, I don't know, but if I don't go back to work tomorrow, that's how he is responding. So what is this kind of statement in a person who received a very good job promotion just 3 days ago? It is an example of adjustment disorder with a depressed mood. Same thing happens. You will top the NEET PG entrance, you will become a MD General Medicine or a MS General Surgery or a MD Gynops. The moment you jump into your first day of residency, there are so many things to do. Fast writing of discharge summaries, fast disposal of cases, running around OPD to OPD, running to the blood bank. First 1 month of time, it will be like an adjustment disorder. What is this life? Is it this life for which I have done all this NEET PG? Yes. But after 1 month, you start enjoying once you know the protocols. A previously healthy 18-year-old woman, loss of appetite, sleeplessness, extreme irritability, and she has a regular menses. Then her main issue is loss of appetite, sleeplessness, extreme irritability, and she has quit the college, and she is no more enjoying the enjoyable activity like playing the swash game, which she was enjoying earlier. So what is the most likely situation with her? So there are certain criteria that define the major depressive disorder, minor depression, dysthymic disorder. There are clear definitions. You can review in the U-Medico question bank in the video library. What are the criteria for each of them according to the DSM? You have to be very sure. 57-year-old accompanied because of a 2-year history of fatigue, and his tonsils and adenoids were removed like when he was a child. The nasal septum is in midline, but he snores frequently during the night and sometimes wakes up gasping of air. So it is a classical example of sleep apnea, and he need to undergo the sleep studies is considered to be the management. A 52-year-old, her husband died 2 months ago, and she frequently cries and she feels her life is empty and worries about her future. So what do you want to do with her? You allow her to express herself. That is a bereavement reaction that the patient is having. When somebody's job is lost, somebody's wife is lost, it is one of the major crises that they pass through. So during that period of bereavement, you need to allow them to express themselves instead of starting any drug therapy. A 52-year-old with a glioblastoma multiforme in the frontal lobe told you that she don't want operative treatment. After that, she went into coma. So what is the most important thing that you want to do? Whatever that the patient expressed that I want this to be done when her consciousness is intact, that is the thing that you need to do when she has gone into coma, provided you have a documented evidence of what she said. 10 years ago, a 60-year-old has undergone aortic valve replacement, and there is evidence of congestive heart failure. So she had a porcine heterograft. So between a bioprosthetic valve versus a synthetic valve, one of the important challenges is with synthetic valve you need to maintain a significant amount of anticoagulation, but a bioprosthetic valve is subject to degeneration. So what she had is actually the degeneration of the valve that has been placed long ago. A 42-year-old comes to emergency with a 2-day history of intermittent lower abdominal pain. She has underwent the hysterectomy around 2 years ago for the leiomyoma, and the abdominal X-ray has been shown to you, which is showing 8 fluid levels with an intestinal obstruction. What is the common cause for that? It is the development of the adhesions which is responsible. So it is a proliferation of the fibroblasts forming a scar tissue in the area of the operation, leading to the development of the adhesions responsible for the obstructive features that you are able to see. 4-year-old, 4-month history of difficulty running and frequent falls. Lumbar lordosis is being found. Sensation is intact, and you can see the presence of the hypertrophy of the calf muscles, which is a classical feature of Duchenne's muscular dystrophy.